Hey everybody, my name is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Denture Implant Center. And earlier I created a video talking about the most common misconceptions of dental implants. And I focused on several points, but one of them was talking about bone grafting. So, bone, why are we talking about bone? Just wanted to kind of give you a little background information about myself and maybe why this video might be a little bit different from a lot of the videos that you might find on YouTube. I am a board certified periodontist, currently in my 11th year of practice, and I've placed somewhere between 5 to 10,000 implants. Honestly, I have no idea how many that really is between all these years of practice. But as periodontists, we are bone and gum specialists, actually. Periodontium refers to support of your teeth, and that's what we specialize in, bone and gum doctors. So, bone and gum can have very significant impacts in regards to not only survivability of your implant. You know, when you're investing thousands of dollars into replacing a teeth or multiple teeth, you want to make sure that you're holding on to that tooth for as long as possible, maybe your entire life. But also, dental implants and the surrounding bone and gum has a very significant impact on the aesthetics of your implant also. So if I can show you a quick little example. Here's an example that I was sent about 9 years ago from one of my former co-residents. And this was a patient that she saw in Virginia. And essentially, long story short, this patient, and you might be looking, oh my God, what happened for this patient to be smiling? And obviously, this tooth is the implant. What happened when, how could this possibly happen and result in something like this? And ultimately, it was a result of the surgeon not adequately planning for that patient to have an adequate amount of bone and gum for that procedure when placing that dental implant. Now, there's some other factors that are also involved without getting too, spending too much time on this video. Essentially, what that patient lacked was sufficient bone and gum. So obviously, when we see something like that, we must think, all right, so how are we going to make sure that that patient is going to have a result like that? So there's several different cases in which bone grafting. So let's start off at the beginning. You need to have a sufficient amount of bone surrounding the dental implant. So let's take a quick look at an example at a 3D scan, what we're talking about here. So when I'm surgically planning to place a dental implant for a patient that's been missing a tooth, this case in particular, this patient had been missing a tooth for many years. She had a bridge, and over time, because bone is living tissue, I like to tell patients bone is like muscles, right? So if you don't have a tooth here for many years or even any short period of time, what can happen is that your bone atrophies, your bone thins out because there's no pressure in the area. As a result of that thinning out, we can have a deficiency of bone. So let's take a look real quick, and we see that ideally we need to have a certain dimension of dental implant placed here in your jawbone. And if you take a look at this from the side profile, you can see that this patient is lacking a significant amount of bone. In a case like this, if we place a dental implant of this size for this molar, what you will see is that this patient is missing several millimeters of bone. And for the actual patient, for the patient to have the best longevity from this dental implant and to make sure that they don't have any long-term issues, you want to make sure that that patient has at least 2 millimeters of bone surrounding the dental implant in all angles, in all planes. And so this patient would need to have bone at least out to here. Otherwise, what ends up happening is that this patient will then develop bone and gum issues. Essentially, the threads of the dental implant will become exposed. Bacteria gets exposed into the tiny little pores and threads of the dental implant, and then the patient starts losing gum. And over several years, this patient starts developing a aesthetic and hygienic nightmare where the dental implants are exposed, and basically we're just now going to have issues later on down the road and potentially resulting in dental implant loss. Obviously, if this is a front implant, then also there would be aesthetic issues, potentially looking like that patient that I was showing you earlier. So what types of bone grafting are there essentially? So ideally the best way to do bone grafting is if a patient currently has a tooth and they know that they're going to lose that tooth, what we can do is we can take the tooth out and we can do something called bone grafting at that time. Basically, you'll have a hole in your jaw, your socket where the root used to be, and what we'll be able to do is we'll be able to fill that socket with bone. We'll put something called a membrane on top of that. And then also we will have a non-dissolvable stitching back and forth to really hold that bone and that membrane in place. And also go over some more detailed instructions to not disturb that area so you have the best result from your bone graft. Some of the areas that I've seen gone wrong in cases like this is where patients essentially, where the doctor puts bone graft there but uses a more flimsy, not long-lasting membrane. And then also your doctor might also use a resorbable membrane like gut sutures. I mean, gut resorbable suture like gut sutures, or something that's supposed to dissolve away in a few days to a week, which is always a really bad idea when doing bone graft. Again, you want to make sure that you're getting this done with an experienced surgeon who's using a good bone quality bone graft. Also using something called a membrane on top of that, whether resorbable or non-resorbable, and also making sure that you have a suture holding that bone grafting membrane in place that is not dissolvable. So some of them are called Teflon sutures, polypropylene sutures. So those are some examples that you want to make sure that your surgeon does pretty well to make sure you have a good bone graft. Now, there's also patients that we will get that need dental implants that have already been missing that tooth. So cases like that, if they have, what we'll do is we'll do that 3D scan as I showed you earlier. If that patient does have enough bone, maybe there is no bone graft that's needed. Most cases aren't like that though. So we will see patients that are missing a little bit, or like an ideal amount of bone. So what we can actually do in those cases is actually place a dental implant and then also add some bone, what we call bone and membrane, on the outer surface of that. So we can essentially, it's almost like spackling on more bone and membrane on that area. So you do that, give that patient about 4 months to heal, and then you go back in and you'll see like a good amount of bone, a sufficient amount of bone to make sure that that patient has a good long-term result from having that, for that dental implant. There are cases also, like I showed you earlier, like this, where the patient's been missing that tooth for a long time. Again, keep in mind, the longer you're missing a tooth, the most likely the more resorption that you will have of bone here. So in cases like this, we need more significant bone grafting. In this case, we did something called guided bone regeneration with the use of, again, an onlay graft where we add all that bone. But whenever we're adding bone, I tell patients it's like adding concrete, right? So you would never step on a wet concrete sidewalk or anything, right? So you want to give it time to set. And so what we'd have to do is we'd add all that bone. But the problem with our jawbone is that chances are likely that when you might have a surgery done on your lower right area, but in the next few months, if you're chewing on something, some food works its way over and it distorts that area where the bone is trying to set, then it literally could be catastrophic to the area and cause failure for the bone graft. So in cases like that, we have something like non-resorbable membranes that we use, something called titanium mesh, or titanium reinforced Teflon membranes, anything to really give support to that area so that, God forbid, there was any movement or anything hitting that area, that the area wouldn't be too disturbed that the bone graft would fail. So looking at the example that I was giving you earlier, here you could see again the amount of bone that we had before we did any sort of bone grafting. Here is what the bone looks like after bone grafting. This is what we call the titanium mesh membrane, by the way. So, and then here is what it looks like after the dental implant is placed, and you see all that bone there. So that's basically an example of what we would call guided bone regeneration, which is a much more involved type of bone grafting that may be necessary. So the scale of bone grafting that you may need, and again for your dental implant, could be as simple as doing a simple extraction and socket preservation, where we're taking the tooth out. You got a nice little hole there, place the implant in there, the bone in there, let it heal for several months, and the bone heals beautifully. Or it can definitely be a more complex bone grafting that you need, for example, guided bone regeneration that we just showed you an example of, or also something like sinus lifting, and I'll talk about that in other videos. But just long story short, there may be bone grafting that may be necessary for dental implants. And again, if you want the best result for your dental implant, bone grafting is definitely something you should be interested in getting to make sure that you have the adequate amount of bone. So how would you know basically whether you needed bone or not? So some tips for you guys when you're going out to get a consultation is ask to see your 3D scan. That's really how we take a look and see, all right, does this patient have enough bone or not? And that 3D scan really tells us, especially if you're already missing the tooth, whether you're going to need some additional bone or not. If you still have that tooth, then you might say, well, do I really need a bone graft? Honestly, I've placed, again, like I said, 5 to 10,000 implants. In my mouth, you're doing a bone graft. There are actual certain instances, though, where you can actually get away with a bone graft or not. But again, I've probably extracted over 100,000 teeth in my career. And how you see patients heal afterwards, depending on if they have thick bone and gums, thin bone and gums, what was the reason for the tooth loss, was it a fracture, a root canal infection, so many different factors come into play. It is very hard to predict how much bone is going to be there if a patient was to take a tooth out and allow a normal blood clot to heal there and see how much bone would be there in the end. So it's kind of interesting because even again, in my 11th year of practice, I try to predict how much bone is going to be there. And I still find it very difficult to be able to predict, again, whether a patient, how much bone is going to be there in the end and whether that patient would have needed a bone graft or not. So to be safe, I would always say, go ahead and get that bone graft and membrane. Now, obviously, there is an additional cost for it. So that's another thing that you need to factor in regards to that. I definitely would say for anterior aesthetic sites, if you're getting a dental implant up front, I would definitely say that that's very important that you get a bone grafting. And for anterior aesthetic sites, I would definitely advise that you go to some sort of surgical specialist to make sure that you get the most abundant bone grafting done in that area. No offense, I just think that they have the most experience. And as that picture I showed you earlier, you don't want an aesthetic result like that, especially, like that TV show you see botched. You definitely don't want to be botched. You want to make sure that you have an adequate amount of bone up there. So hopefully you guys found this information helpful. If you guys ever have any questions, please feel free to leave a comment below or come in for a consultation. More than happy to help you guys out. Thanks.